Thank you. Hello, dear ladies and gentlemen. I hope you are not yet tired because it's already the end of the day. um, Today, I would like to present you my talk on the estrogen dominance and conditions related to it. So on this title picture, not accidentally, I put these beautiful eustoma flowers, actually one of my favorite, because they strongly remind me the look of fibroid nodes intraoperatively. If any of you is a gynecologist and did surgeries like a hysterectomies due to fibroids, so I believe you agree with me that strongly remind. Why am I pointing? This is actually the pathologic preparation of the removed uterus with the fibroids. So uterine fibroids is one of the conditions that is a resultant from the estrogen dominance imbalance in a female body. What is exactly the estrogen dominance? The definition of it. First, it was mentioned by American doctors in 1996, John Lee and Virginia Hopkins, in their book, What Your Doctor May Not Tell You About Menopause, and the breakthrough book on natural hormone balancing, where they criticize the estrogen-based hormonal replacement therapy used in the menopause and suggest the use of natural progesterone to tackle the symptoms of menopausal symptoms. So they claim that in the perimenopausal menopausal transition, what is happening? The drastic drop of progesterone is happening way more faster than drop of the estrogens. That is why the estrogen effects prevail over the progesterone ones. And it's actually true and quite corresponding to the reality because in perimenopause, women start to have menstrual cycles which are anovulatory. So no more ovulation, no corpus luteum, no more progesterone is being synthesized. That is why estrogen effects prevail and go up and become expressed. So, but nowadays the phenomena of estrogen dominance and conditions related to it are way more common among women of reproductive age. It is caused by the rise of inflammatory lifestyle, the so-called inflammatory lifestyle. Later I tell more about this. Yesterday actually already I also mentioned this. So estrogen, the necessary evil and how to tame it. This name is also quite, corresponding to the estrogen because this pivotal hormone and life-giving hormone, the one that promotes the development and estrus in female, at the meantime possess their properties that are quite harmful for the body and is in the center of metabolic infections, autoimmune and degenerative diseases. On top of this, apart from its good and positive roles in the female body, such as regulation of the sexual development, balancing the immune system, neuroprotective effects, bone health, of course, fertility and menstrual cycle regulation, and all in all, at the meantime, it is very potent clustergen, morbidogen, and carcinogen at the meantime. Why? Because it, due to its imbalance and not proper metabolism, also later on I will be going through the details of this process, pathologic process. So it harms the DNA strand, causing the mutations and subsequently cancerous processes. Estrogen-related cancers, such as cancer of endometrium, breast cancer, ovarian cancer, that is quite already studied and proven a lot, but the estrogen also can cause other types of the cancer. And not only in women, in male also, such as prostate cancer, lung cancer, stomach cancer, and even autoimmune diseases such as lupus erythematosus also can be caused by the hyperestrogenemia. Even schizophrenia, like psychotic disease, also can be due to imbalanced estrogen in the body. So the biological role of estrogens is extensive. Just now I already mentioned some of them, but if we go with the details, so of course it's a sexual development promotion, of course it's a menstrual cycle regulation, ovulation, it induces the turnover, growth and proliferation of endometrial cells and also other estrogen sensitive cells in the body, in the genital and urogenital system. Bone maturation, neuroprotective effects, it dampens the inflammation in the brain. It balances the metabolism of glucose and lipids in the body. It actually accelerates metabolism because, yeah, it's well known that when women become menopausal, her metabolism slows down naturally, and she started to gain weight, especially central type of obesity. It's also related to the loss, to the drop of estrogen. Bone maturation, yesterday already there was a whole lecture about this. Skin maintenance, so extensive effects of this hormone in our body. We are so much, it's so much essential and we really need it, but we need it to be balanced, to be opposed by the progesterone. Progesterone opposes estrogen, causing the transformation of endometrial lining. So in the first phase, in the follicular phase, the endometrium is going through proliferation stage. So fueled by the estrogens or stimulated by the estrogens, it grows and proliferates, become thick, right? Sufficiently thick. Preparing for implantation the female body. And in the second phase, in the luteal phase, under progesterone effects, it undergoes transformation. So this is the secretory transformation, the so-called. If it doesn't happen, so it leads to hyperplasia and adenocarcinoma, also very well known thing. Symptoms of excessive estrogen in women. It's a breast tenderness, it's a headaches and fatigue, it's a weight gain. Actually, just now I mentioned that imbalanced estrogen and drop of it in the menopause causes the weight gain, but the excess of it also can cause obesity and weight gain. So there should be in the middle something. Decreased libido, endometriosis, fibrocystic disease of the breast, endometrioid cysts, psychotic effects such as depression and anxiety. But also in menopause, women experience in menopause, when there is a low estrogen, also experience psycho-emotional disorders such as anxiety and depression. So it's both excess and lack of it, both are not good. Supposed to be a balance. Polycystic ovary syndrome is also the condition closely related to hyperestrogenemia, because excess of androgens and their aromatization leads to hyperestrogenemia and effects and hyperexpression of it. Patients who are on the HRT, they also experience the symptoms of hyperestrogenemia if this HRT prescribed not it is supposed to not correct prescription, right? Cancers, of course, as I mentioned, breast, ovarian, endometrial cancer, and other types of cancers. Even infertility due to hyperestrogenemia also can be related to this. In males, this hormone is quite important because it promotes bone health, it promotes sexual health, libido, and normal sperm genesis. So if it's fueled, for example, due to hyperthyroidism, due to hepatocellular carcinoma, due to cancer of adrenal glands or testes, cirrhosis, and also those who are on the testosterone replacement therapy. So these men can experience the symptoms of hyperestrogenemia, such as gynecomastia, such as symptoms of feminization, depression, migraines. Also can be infertile due to hyperestrogenemia. Also should be addressed even in men, not only in women. Okay. Types of estrogens, the most important types of estrogens that exist or work or exert the effects in female and male bodies. Depends on the amount of hydroxyl groups. There is a estron, E1 estradiol, E2 estriol, E3 and estetrol, E4. The most abundant hormone and the most potent during reproductive period, of course, it's estradiol. It is 10 times more potent than estron. Estron is the main hormone in the postmenopause. Postmenopausal women, they experience effect from the estron. And estriol, this hormone is dominant due to during the pregnancy months. Okay, estetrol is not well known, but it also take place and is produced by the fetal liver during pregnancy since 9th week of gestation. And nowadays there are oral contraceptives that contain synthetic estetrol. But overall, for our lecture, it doesn't have much of importance. So this is the chart of steroidogenesis in the female body. Of course, the major place of production of estrogen is ovaries, of course. But also there are secondary sites of production of the estrogens, including adrenals, including subcutaneous fat, including bone, liver, pancreas, brain, skin, breasts. In male, it's the testicles, and placenta during pregnancy. During pregnancy, the production of estradiol and estriol rises times higher. That's why women during pregnancy have very nice hair, exceptionally good hair, exceptionally good skin. So all these are effects from the estrogen produced by the placenta. So you can see estrogens are in the pink color on the bottom on the right triangle, and you can see that they can be produced only from the androgens, not any other substances in this cycle can be precursor. Only androgens can be precursor of the estrogens. No other way of the production. Just bear this in mind. So in the ovaries, where is being produced the precursor of the estrogens? It's in antral follicles. You can see secondary follicles, the one that they have theca interna. Theca interna, it's one of the layers surrounding oocyte, okay, layer of the cells. So in theca cells, out of cholesterol, undergoing all those cycles, is being produced testosterone and androstenedione, precursors of the estrone and estriol. Okay, then they go through the basal membrane into granulosa cells, and under stimulation of follicle-stimulating hormone, there is a conversion, and this reaction is catalyzed by family of enzymes. P450 aromatase, and in granulosa cells, we produce estradiol, estrone, and estriol. So here need to remember these important enzymes, aromatase, and also 17 beta hydroxysteroid dehydrogenase, the one that catalyze reaction of conversion estradiol to estrone and back. But for us, the most important to understand the first one enzyme, the one that promotes conversion of estradiol to estrone, because estrone is less potent than estradiol. Okay. This is estrogen metabolism and excretion. Because abnormal metabolism is actually the major reason of hyperestrogenemia or overexpression of the estrogens. That's why we need to understand what's going on exactly. Okay, all about liver detoxification. Any medications we take, any hormones we produce in our body undergo detoxification and neutralization, breakdown, and excretion in the liver. Okay, so for the estrogens, same thing. For dopamine, for catecholamines, for all the bioactive substances is being produced in our body, is all the same, detoxification. So in the first phase, the organs, the one I mentioned, sites of production of estrogen, such as ovaries, adrenal glands, adipose tissue, and other peripheral organ sites, they produce estrogens. These estrogens are released in the bloodstream. With the bloodstream, they get to liver. So what is happening in the liver? In the liver, there are two phases of detoxification they undergo, right? The first one is when the fat-soluble substance is being converted to its activated intermediate. This reaction of hydroxylation, so hydroxy group attaching to the molecule, okay? So this is the first reaction. And it is promoted or catalyzed by the family of CYP, also belonging to cytochromes 450. Important, okay? Next phase is when this activated intermediate is converted to water-soluble metabolite. That can be happened via sulfation or leucoronidation or methylation. Estrogens mostly are converted or via the methylation process. And also, very important to emphasize the third phase of detox. So after these compounds are being produced in the liver after second phase, so water-soluble compounds, let's say it's a glucuronized estrogen or methylated or sulfated, okay? They reach intestine. So in the intestine, we do have microbiome, millions or billions of bacteria. And some of the strains, actually around 40 strains of bacteria, are able to produce enzyme beta-glucuronidase. So this conjugated estrogen, the one that is already non-active, not exerting its effects anymore, under beta-glucuronidase, it become deconjugated. So detachment of this glucuronide acid, and again it's been recirculated in the blood and exerting its effects on the organs where those that contain receptors, alpha and beta receptors to estrogen. Okay, so that is how we receive extra estrogen effect from this estrogen. Actually, they are supposed to be utilized and excreted via intestine. But no, part of this estrogens recirculated back. One of the mechanisms of estrogen dominance. And also this mechanism it was proven and studied, lies in the genesis of estrogen dominant conditions. First of all, it's cancers, endometrial hyperplasia, polycystic ovary syndrome, ovarian cancer, endometriosis, and so on and so forth. You may see in the upper part of my slide estrone and estradiol, which are connected with glucuronic acid, get into the gut and become deglucuronized, deconjugated. This publication, the one that about the dysbiosis as a possible cause of the cancers and estrogen dominance. Those conditions such as bacterial syndrome of bacterial overgrowth or fungal overgrowth can be the cause of estrogen dominance. Also later, I will talk more about this. Let's go through the first and second phases again of detoxification. And we can see that first phase, like I said, is catalyzed enzymes of family P450 cytochromes, which are CYP-A1A, CYP3A4, and CYP1B1. There are three pathways. So the pathway 2-hydroxy is a safe pathway. And if everything is okay and there is a balance, it's 70% of the estrogens supposed to be utilized by this 2-hydroxy pathway. In case, and the rest 4-hydroxy and 16-hydroxy, they are potentially carcinogenic. So the amount of estrogens that are utilized via these two pathways is supposed to be only 10% it's regarding 4-hydroxy, and only 20 if 16-hydroxy. So the second phase of detoxification, you can see this red color carcinogenic substances. They are called quinones or semiquinones. So in the second phase of detoxification, the one that is catalyzed by catechol O methyl transferase and glutathione S transferase, these two enzymes, the quinones and semiquinones, which are carcinogenic, supposed to be neutralized. In case of insufficiency of this enzymes, catechol O methyl transferase or glutathione S transferase, the amount of quinones is excessive, and what is happening next? They bind to DNA, promoting the estrogen DNA adducts, the so-called. So these quinones make with DNA strand and actually with purine acids, adenine and guanine, particularly, covalent bond, which is very strong if you remember the course of chemistry at school. So the covalent bond is the strongest one. And our body have their systems that try to repair DNA, okay? And what is happening? Literally, these substances, this connection cannot be broken, cannot be removed, these adducts, and they're just excision, exceeded these parts of the DNA, literally holes in the DNA that are leading to mutations and cancer in the end of all. So what we're supposed to do, the application point of the treatments supposed to be the neutralizing or redirecting the pathways from two protective ones to the safe one, to the 2-hydroxy pathways of estrogen metabolism. So we prevent the production of this estrogen DNA adducts that harming, that damaging the DNA, leading to mutations and cancer in the end of all. There are causes of estrogen dominance. One of probably known. First, it's a genetic predisposition. Genetic predisposition means polymorphism of the mentioned previously enzymes such as catechol or methyltransferase and glutathione S transferase. So genetic polymorphism of these genes leads to 3 or 4 folds lower activity of these enzymes. And if they are not performing their function properly, not catalyzing the reaction of detoxification, we receive estrogen dominance effects with excessive production of quinones and semiquinones and estrogen DNA adducts. So this category of women, they pass in a female part from mother to daughter, from daughter to her daughter, this genetic predisposition to develop estrogen dominance conditions such as fibroids, such as endometriosis. But even having this predisposition and knowing this, you still can improve the function, like improving the detoxification function of the liver, improving the activity of these enzymes. Later also I mention how you can do this. Hormonal medication, hormone replacement therapies, obesity also is quite clear the mechanism, because there is an excess of subcutaneous fat and reaction of aromatization, excessive amount of estrogen are being produced in the peripheral organs. Gut dysbiosis and constipation. Here the mechanism is an excess of beta-glucuronidase produced by those bacteria, those strains of bacteria, due to, for example, like I said, syndrome of intestinal bacterial overgrowth or syndrome of fungal overgrowth. Constipation, due to slow passage of the food or content of the gut, intestine, there is more time for these bacteria, let's say, to deglucuronate the estrogen. So more estrogen became recirculated in the bloodstream. Okay, constipation, one of the reasons of estrogen dominance. Endocrine disruptors and xenoestrogens exposure. This is also quite painful topic, because unfortunately we are surrounded with the xenoestrogens and endocrine disruptors. First of all, it's a plastic. Then phthalates, dioxins, flame retardants, pesticides, bisphenol A, PCB, polychlorinated biphenyls. So all these substances can promote estrogen dominance, causing cancers, such as ovarian cancer. Also, there are studies on this. Impaired liver detoxification function, that's clear. Anovulatory cycles, because less progesterone is produced, so it does not oppose properly the estrogens. Inflammatory lifestyle. So what means inflammatory lifestyle? Of course, it's a poor diet, excess of trans fats, excess of the carbohydrates, of the processed foods, low in fibers, low in protein. All this lead to promotion of the inflammation, chronic low-grade inflammation in our body. Alcohol consumption, drug exposure, lack of physical activity, and of course it's emotional stress. All these factors promote oxidative stress, and oxidative stress lead to excess of inflammation. Inflammation leads to hyperactivity of the enzymes such as aromatase and other enzymes that lead to excessive production of the estrogens, and inhibits the detoxification enzymes in the liver at the meantime. This one of the publications that proving the effect from the xenoestrogens, such as formaldehyde and formaldehyde releasing substances. So the women are using straighteners to straighten the hair, okay, that containing these chemicals, and it was proven that it increases 80% risk of adenocarcinoma, so uterine cancer. The frequency or the duration of the use doesn't matter. Every use, already you get this promoted cancer in your body. So better to stay away. Pathophysiologic mechanisms of the estrogen dominance. First, it's exposure to endocrine disruptors and xenoestrogens. Second, impaired synthesis. Impaired synthesis, hyperactivity of aromatase, hyperactivity of 17-beta-hydroxysteroid dehydrogenase. Second enzyme, remember the chart, the one that catalyzed reaction of conversion of estradiol to estrone, less active, so less effects. Also, its activity, low abnormal, leads to hyperestrogenemia and overexpression of estrogens. The receptors can be excessive amount of receptor or excessive sensitivity of estrogen receptors, alpha and beta, due to different reasons. Altered signaling cascades inside the cell, and impaired metabolism and excretion by liver and gut. As an example is endometriosis. It was also like a study of the mechanisms developing of endometriosis. Endometriosis is a well-known problem in female, and it's characterized by the abnormal growth of endometrial cells outside of the uterus, or whether it's myometrium or ovaries or tubes or vagina or wherever. So this study revealed two mechanisms. First, it's aberrantly expressed aromatase, and second, deficient 17-beta-dehydrogenase. Diagnostics, how you can diagnose estrogen dominance, for example, or how you can prove that metabolism of estrogens is abnormal, or there is a problem with gut, for example. What you do, you just Dutch test, dried urine test for comprehensive hormones helps to reveal, because it shows all the metabolites of the estrogen in the blood. Evaluation of the symptoms, of course, symptoms-based diagnostic. To consider related conditions, to check the absolute levels of hormones of estrogens, progesterone, and androgen, to test the gut dysbiosis finally, and check the liver function. There is also assay or analysis such as hyphenated liquid chromatography, the one that, or mass spectrometry, the one that helps to reveal the amount of these carcinogenic quinones and semiquinones. But it's quite rare, this analysis. But anyway, it is available, one of the available methods how you can diagnose. The mainstream treatment for hyperestrogenic conditions such as endometriosis, fibroids, endometrial hyperplasia, all anti-estrogen treatments. Progesterone and progestins, synthetic progesterone, aromatase inhibitors, selective estrogen receptors modulators, gonadotropin releasing analogs and antagonists, anti-gonadotropins, and finally even the ovarioectomy can be the treatment. The ways, like common ways how you can decrease the effect of excess of any hormone in our body. You can block these receptors, you can increase the metabolism of the hormone, you can remove the gland or tissue that producing this hormone, or you can modulate the target organs receptors. So that's what is being done by the mentioned medications. The suggestions from regenerative medicine. First, of course, it's a lifestyle modifications. Actually, also it's wide highlighted in the literatures, in the medical publications and wherever, that the most of causes of estrogen imbalance and estrogen dominance is an abnormal lifestyle. Not even genetic predisposition, not that much other reasons. Lifestyle, like I said, inflammatory lifestyle. So what you can do, decrease the amount of factors causing inflammation in our body, such as improving your diet, quit all the bad habits, manage stress exposure, which is also quite important, to improve sleep, water intake, implement regular exercising, avoid endocrine disruptors in every way, in cosmetics, in a place where we live, because like I said, even plastic, for example, you use plastic containers to transport the food. They emit and release the harmful substances causing working as xenoestrogens and leading to mutations and cancer. Change to glass container. Already you will reduce the exposure. Cosmetics, you can use the one that does not contain the harmful substances which serve as endocrine disruptors. Okay, all of us, we like to use the perfumes. We like to use the aromatic candles, and they use phthalates to fixate the smell. They use phthalates, and phthalates work as xenoestrogens, as endocrine disruptors number one. Weight maintenance. Obesity factor also is one fueling the estrogen dominance. So to reduce excessive weight, to normalize the amount of subcutaneous fat in your body. Promote detoxification via regular exercising, sweating, sauna, using infusions with chelation agents. So all the methods of detoxification would work. Using the probiotics, pre, pro, and postbiotics, regular use or whichever, whenever it's needed. So that also would help. The use of diindole methan and indole 3-carbinol. These substances that derive from cruciferous, broccoli, Brussels sprout, all contain this sulforaphane, which is the substance that help to redirect the harmful pathway of estrogen metabolism to the safe one, to 2-hydroxy, if you remember the one that I mentioned before. Choline therapy. Choline therapy, phosphatidylcholine and other choline-based supplements, they work as cofactors for methylation, as well as vitamins group B, as well as magnesium, zinc, vitamin D3. Calcium diglucarate. Calcium diglucarate neutralizes the beta-glucuronidase in the gut that produced by the microbiome in the gut. So it helps to neutralize this part and also redirect to safe metabolism pathway of estrogens. Diet. Number one recommended is Mediterranean diet, rich in fibers and plant fats. Anti-inflammatory protocol, excluding the dairy products and gluten-containing products, also may work. Every day it is recommended to eat a handful of cruciferous: cauliflower, broccoli, cabbage, Brussels, kale, All of this is available nowadays in the supermarket, thank God. Products of natural fermentation, such as tempeh, such as sourdough, sauerkraut, Greek yogurt, kombucha, natto beans, kimchi. Those also every day should be taken a handful or even more. That promotes a healthy gut and balanced microbiome. Okay, preventing the bacterial overgrowth, fungal overgrowth, and so on and so forth. This one of our proud products, GI Proenzyme Synbiotic, the one that contain inulin as prebiotic, the one that contain bacteria, live bacteria, also proline, lysine, and bromelain and papain as digestive enzymes. Very good reviews, very good feedback on it. Liver detoxification supporters. So as I mentioned before, it's diindole methane, of course, and indole 3-carbinol, the derivatives from sulforaphane, from the cruciferous, and promoters of the second phase of liver detoxifications, such as magnesium, S-adenosyl methionine, known as heptral, betaine, methylated group B vitamins, B6, B12, and folic acid, choline, and glutathione. Glutathione is also one of very good antioxidants and liver detoxification promoters. Choline therapy, also another our proud product, alpha plaque X and plaque X, containing phosphatidylcholine. If we talk about plaque X, we have it in infusions, we have it in the soft gels, and updated or advanced formula alpha plaque X, the one that contain cytidine diphosphate choline and choline alphocerate and vitamin E. Phytowhite tripeptide extract. It's a oral form of glutathione. It helps to increase detoxification function of the liver and supporting all the enzymes like glutathione as transferase and COMT, catechol or methyl transferase. Swiss Natural Heavy Metal Detox. This product, also for per-oral use, it contains N-acetyl cysteine. N-acetyl cysteine is a known precursor of glutathione. A part of this, it contains green algae, coriander, which is cilantro, and black cumin seed, also known very good detoxifiers in our body, and the publication supporting my words. This should be taken 15 drops or 1 ml sublingually, 30 minutes before meal, better before breakfast, for months, like a few months, 3-4 months, this standard course that we usually prescribe. Swiss Natural Inflammatory Response Support, the one containing resveratrol, camphorol, apigenin, very well anti-inflammatory agents. So they help to decrease inflammation in the body and decrease the enzymes activity such as aromatase, blocking also the production of estrogen DNA adducts. Same way of administration. ImmuneVit, also another our proud product, combination of vitamin D3 and K2, 5,000 international units, plus 100 micrograms of K2. Also supported with lecithin and virgin coconut oil. One soft gel for daily for 4 months, that course that we recommend. After that can do break for 1 month and again to repeat the course. So it works anti-inflammatory, it works anti-cancerous, and it also decreases the activity of aromatase. This range is quite new. It's a Swiss Nature Phytomyco products by our company. So what I recommend out of this range to address the problem such as estrogen dominance is a Swiss Nature Phyto-Female Vitality. It's purely herbal components, ashwagandha, asparagus root, eleuterocoque, magnolia. All of these components help to reduce harmful effect from the excessive estrogens. But at the meantime, they exert mild estrogen-like effects. So very good for women in the perimenopause or menopause. The one that, for example, who have estrogen dominant conditions such as fibroids or endometriosis, but at the meantime, menopausal symptoms experience, so imbalanced estrogen. So for them, this product will be the best. Also, 3-4 months course, it's a vial for oral use to drink. Another product is Swiss Nature NMN Cell Revitalizer with resveratrol, with glutathione, with pyroquinoline quinone. It's a powerful antioxidant, powerful anti-inflammatory product. Also is helpful for liver detoxification and to block harmful DNA adducts production in our body. MCE Evolution. It's a soft gels. This product is very well known and popular on the market among our clients. It contains omega-3, it contains coenzyme Q10, vitamin C, krill oil, and chondroitin sulfate for joints, which is very good for joints. So it will be anti-inflammatory, it will be antioxidant, it will be promoting detox function of the liver. Active Essentials Pro, another proud product of our own. Apart from its good effect in terms of energy, increasing the energy, okay, because it contains L-carnitine. It also contains betaine as antioxidant, magnesium, zinc, and conjugated linoleic acid. So it will be working perfectly on steroid metabolism, both in male and female. We like this product to treat infertility, for example, to improve steroidogenesis, but at the meantime, it can be administered to patients with imbalanced estrogen metabolism. One soft gel twice a day for 4-6 months. Finally, stem cells. How you can improve estrogen, how you can treat estrogen dominance with the help of stem cells. First, you can prescribe mesenchymal stem cells, the one that work anti-inflammatory. Second, you can promote the function of organs, performing the detoxification and excretion of these estrogens. So you can administer the cells of liver, kidney, intestinal mucosa, and also thymus to balance the immune system and receive anti-inflammatory effects. Peptides derived from the same organs, kidney, liver, mesenchyma, thymus, range different, and all of them can be administered intramuscularly. NOP can be administered orally. In the form of the drops for sublingual use. So it's a mitoorganelles, it's a fresh and pure range, and nano-organopeptides. This is the all the supplements, the one that I just now listed, that can be used all at once. I mean, or you can include them all in the protocol to treat estrogen dominance condition, for example, fibroids or endometriosis or fibrocystic disease of the breast. Or you can pick only some of them. Depends, every time individual approach for your patient, okay? And it does not interfere with the mainstream treatment. So if a woman receives a treatment from the conventional medicine doctor, you just complementary can add these supplements. Of course, need to address deficits if there are any deficits of magnesium, of zinc, of vitamin D3, or group B, folic acid, B12. This should be addressed at the first place. Thank you. My email address, in case if you have any questions, you can always directly email me and I would gladly reply you. Thank you so much. Thank you for your attention.